At Purchase Center Services, we start all of our presentations and meetings with our mission, vision, and values. Our mission: connect people to the care, support, and opportunities that maximize their quality of life. Vision: a community where all people lead fulfilling lives. Core values: people, integrity, and trust. My name is Craig Menig. I'm your host today. I'm the Member Relations Manager of Purchase Center Services. Member Relations has as its goal to empower our members and people with intellectual and developmental disabilities and their families by providing them with resources and education in a variety of ways. Today we are lucky to have with us Rachel Schumann. Rachel is a training and outreach coordinator for the Community Service Society of New York. So Rachel, I'm going to turn it over to you.
Thank you so much, Craig, and thank you for having the Ombuds program today. I'm also very lucky to be joined by my colleague, Lynn Decker, who is our Quality Assurance Manager, and may be here answering questions along with me, but I will be the main presenter. So I'm just going to share my slides and introduce myself, and we can get started. Okay, so hopefully everyone is able to see my screen. So as Craig mentioned, I'm here today to talk to you about the Intellectual and Developmental Disabilities Ombuds Program. But first, I'll introduce myself. So as Craig mentioned, my name is Rachel Schumann. I'm the Training and Outreach Manager here at IDDO, or the Ombuds program. My previous experience, I am a social worker, and I've also had experience helping people navigate Medicare and Medicaid. And I have a personal connection to this work. I have 2 siblings on the autism spectrum. Lynn, I don't know if you quickly want to just chime in and introduce yourself briefly before I talk about the program.
Sure. My name is Lynn Decker. I am the Quality Assurance Manager for the program, which means that I make sure that all of our characterizations of our callers are consistent and correct for our reporting, and help people with difficult subject matter questions. I previously worked for another community service society-led Ombuds program for people in managed care plans, mostly older people with a need for home care in managed care plans, called ICANN. And before that, I was a support broker in self-direction. I worked for a DD service agency in Manhattan called JobPath, where I was a service coordinator once upon a time when we had that job title, and led a Without Walls day program. My lived experience is that I have 2 adult sons who live in certified settings. Almost all of our members of staff have some lived experience related to family members with developmental disabilities.
Thank you, Lynn. Yes, that's kind of the really unique and great thing about our program, is that a lot of us are coming in with both professional and lived experience with this community. And I think of Lynn as like our encyclopedia. Like, she has so much knowledge and has been in this work for a very long time. Not to age her or anything, but she is definitely like our team encyclopedia, for sure. So what I'm going to talk about today, I'm going to talk to you about the program. What is the Intellectual and Developmental Disabilities Ombuds Program? Then I'm going to talk to you quickly about what organization operates the program. It's the organization that Lynn and I both work for, called the Community Service Society of New York. And then I'm going to get into more specifics about what our program does, the work that we do, and then we can open it up for questions. So what is IDDO? If you happen to be able to see the screen, you will see our logo. We hope you like it. It's orange and has different shades of blue in sort of a mosaic / sun shape. So we are an ombudsman. So for some of you, this term ombudsman or Ombudsprogram is maybe new to you. So the term ombudsman comes from the Swedish language. It means representative. And generally, an ombudsman's job is to advocate, educate, and mediate. So, try to help resolve problems. And there are all different types of places that can have ombuds programs. So nursing homes is a kind of well-known place where there are ombudsmen, hospitals, universities, government agencies, insurance companies. So there are all different types of ombudsmen. We're not the only game in town. So how did our program get started? Well, some years ago, there were advocates who felt that there needed to be an ombudsman for people with intellectual and developmental disabilities for a few reasons. One is because the system is really complicated and hard to navigate. Another reason is that they felt that there wasn't an objective resource for information and education. And then the third was there really wasn't anyone to advocate for people with intellectual and developmental disabilities and protect their rights. So, especially for folks who, don't live in OPWDD certified settings or, can't report to the Justice Center or, even for issues that are not abuse or neglect, there wasn't really an advocate that, a general advocate that could work with people with intellectual and developmental disabilities. So IDDO was started through the law. So basically in New York State, they passed a law under the under mental hygiene law, and it's 33.28. And this law says that the Office for People with Developmental Disabilities, or OPWDD, needed to find an organization that was independent to be an ombudsman. And the following year, in 2024, the Community Service Society of New York applied and was chosen to create this program. And CSS, or the Community Service Society of New York, decided to call the program IDDO, or the Intellectual and Developmental Disabilities Ombuds Program. So the term Ombuds Program, we just took ombudsman and program and just put it together. So what is Community Service Society? So Community Service Society has actually been around for a long time, but is new to the IDD or DD space. CSS is a leading nonprofit that mission is to promote an equitable city and state. And the way we do this is through direct services, so by directly helping people, through our advocacy work, so advocating for better policies, and then also doing research, kind of figuring out what are the issues that are facing New Yorkers when it comes to economic opportunity. So we actually have a pretty wide range of programs and services. Always happy to share more information about the rest of our, programs at CSS. But generally speaking, the way we directly help people is through our live answer helplines and our partnerships throughout New York State with community-based organizations. And we assist around 130,000 New Yorkers every year with different needs. So whether that is helping people enroll in health insurance and use their health insurance benefit, or access supports and services. We have a program that helps people navigate student loans. We have other programs that are focused on financial literacy, and also programs that focus on public benefits. So we kind of, offer a wide range of services, and IDDO is just one of the programs within Community Service Society. And one of the reasons why CSS was chosen to start IDDO is because we have experience with running other ombudsman programs. So we actually have 4 other programs: Community Health Advocates, or CHA, the Independent Consumer Advocacy Network, or ICANN, which is the program Lynn, I think, mentioned earlier, the Managed Care Consumer Assistance Program, or MCAP, and the Community Health Access to Addiction and Mental Health Care Project, or CHAMP. So each of these programs kind of serve a different purpose. So Community Health Advocates really focuses on issues with medical care and health insurance. ICANN focuses on individuals who are living in the community and receiving home care. The Managed Care Consumer Assistance Program is similar to CHA, but focused in New York City. And CHAMP, the Community Health Access to Addiction and Mental Health Care Project, focuses on helping people get mental health care and also substance use disorder treatment, so addiction services, actually. So this is just a brief kind of timeline of our beginning to our current day. So the law was passed in November 2023. In February 2024, OPWDD released a request for proposals. In the summer of 2024, OPWDD said, "We choose you, CSS." And in the fall, CSS hired and trained staff, including Lynn and myself. And then in December of 2024, we officially launched. So we're still relatively new, but we have a really experienced team, and we've accomplished a lot in our, I guess, over 6 months of operation now. So our mission generally is to be a resource and advocate for individuals and families as they navigate OPWDD programs and services. So what do we do? So the main thing that we do is we work directly with people with developmental disabilities who are, have questions about OPWDD or have issues with OPWDD supports and services. So we run a helpline where people can call, or you can contact us online with a question or an issue. And if we can answer your question on one phone call or one email, then we do. But a lot of times people contact us because they have, tried all these other avenues to resolve their problem, and they haven't been able to do so. And so if that is the case and it's something we can help with, we refer to that as casework, where we're working directly with you or anyone who's designated as your representative or circle of support to try to resolve the problem. We also do education. So part of my job as the training and outreach manager is to create educational materials and give presentations just like this one and attend community events. We also advocate. So not only do we advocate through our casework, but we also advocate on from a policy perspective. So what we do is we collect data and information on different trends or issues that we're seeing come up, and we report those to OPWDD. And we hope that by reporting on these systemic problems, that we can come up with some solutions or potential resolutions to some of these barriers that folks are experiencing. So you might be asking, well, when should I call IDDO? So there are, several reasons why you may call us. These are just some examples. So we have a lot of people who, they haven't even started the process of applying for OPWDD eligibility. We've gotten actually a number of calls from people who were, from parents of children who were provisionally eligible and now have to kind of get, permanent eligibility. So we assist with those kinds of questions. We help people understand, their life plan and, and if there's something that you want to change in your life plan, or you're, you have a concern about your life plan, we can help with that. We help people explore housing opportunities that they may not know about. We also troubleshoot issues with care managers and service providers. So ideally, everyone would have a care manager and get along smoothly and everything would go well, but we know that sometimes there are, miscommunications or there can be issues with service providers. And so sometimes it can be helpful in those situations for kind of an objective person to come in and try to mediate or facilitate a conversation. The other thing is self-direction. We get a lot of questions around self-direction. How do I get self-direction? I need my budget approved. I'm having trouble accessing services through self-direction. So those kinds of questions are definitely welcome. And then the most important is that we help people fight for their rights. So whether that's the right to disagree with a decision that's been made about your care through OPWDD, or your right to file an appeal, complaint, fair hearing. If none of these words sound familiar to you, no worries. You can always contact us with questions. And we also are planning on launching a website. So if you are, if you are tech savvy and you're online, a lot of this information will also be on our website. So more to come on that soon. We also want to be clear with what we do not do. So, I'm assuming that many of you on this call or who are watching this webinar after the fact are, members or interested members of person-centered services. So I do want to say that we are not here to replace your care manager or your care coordination organization or CCO. The CCO and the care manager serve a really important role. So we are definitely not here to, do their job. We don't provide assistance kind of ongoing. We sort of come in when there's a problem or an issue. We work with you to solve it. And then, we send you on your way with, with the knowledge that if you do have problems again, or you're still experiencing the same issue, that you can always come back to us. So, your care manager and your CCO is someone that, you are supposed to be able to get support from throughout your lifetime if you stay with the same CCO. So, that ongoing support is really, something that you should be getting from your care manager. We also don't help with school-based services and support. So we do get calls sometimes, people asking about, accommodations in school or individualized education plans, IEPs. Unfortunately, that is out of scope for us, but we are always happy to connect you to an organization to receive assistance. And then the last thing is we don't work with families to access early intervention services like ADA or other services through the Department of Health. But again, we have a lot of partnerships throughout the state. And so, we're never going to turn someone away without a resource or appropriate referral. So, definitely feel free to call us, but just know that, there might be some issues that we can't help with. So as I mentioned, we have a helpline. We have 11 people total in our staff. We have 5 counselors, 2 attorneys, and 4 managers. Our helpline serves all of New York State. And you can reach us Monday through Friday from 9 a.m. to 5 p.m. We really emphasize, that our helplines are live, meaning that, when you call us, if you call us between, 9 and 5, there will be, someone to answer your call that is a listening ear and, will be respectful and courteous and try to help you resolve your issue. Our helpline number is 1-800-762-9290. We also have an email address, and once our website is launched, we'll have a contact form that you can also use to get in touch with us. So education and outreach. So we don't do our work entirely alone. We have some partnerships. So we partner with self-advocates, with parent and caregiver groups. We also have a specialist agency that provides our staff with what we call technical assistance. So if there's if we find a question that Lynn does not have the answer to, that is who we go to. And then we have a regional outreach network made up of 9 community-based organizations that are across the state. And I'm going to just share those really quickly. So I believe person-centered services is mainly in region 1 and 2. Am I right about that, Craig?
Yes.
Okay.
Region 1 largely, a little bit of overlap. Yeah.
Okay. Got it. Yeah, I know. Sometimes that part of central New York and western New York kind of blend. So in region 1, our partners are Center for Self-Advocacy and Autism Up. If you don't know of those organizations, they are really fantastic. Definitely recommend you check them out. And then in region 2, which is mainly central New York, we have Mountain Lake Services, which is a chapter of the ARC, and we have Southern Adirondack Independent Living, or SAIL. In the Capital District and Hudson Valley, we have Westchester Institute for Human Development, or WID. In New York City, which is region 4, we have Include NYC and Community Inclusion and Development Alliance, or CEDA. And then in Long Island, we have the Mid-Island YJCC and Extraordinary People in Care Long Island, or EPIC. And these organizations work with us to promote our program and provide education and outreach. And then here is our team, a picture of all of us. We look forward to working with you, and get in touch with us. We also have socials, very, very small pages, but, we're hoping to grow. So feel free to follow us if that's your thing. We'll be posting updates about our website or just updates on the team in general. So yeah, that's all I got.
Okay, Rachel, I have a couple questions for you, if you don't mind.
Yeah, of course. I'm gonna close out my PowerPoint so I can see.
Yeah, so I know person-centered services puts a lot of effort into ensuring our members know the proper avenues to follow when they're not getting what they want, right? We have several avenues for doing that. So when you get a call from somebody who is receiving care coordination, is it standard practice that you'll notify their care coordination organization so we can know that there's an issue?
Yeah, of course. So, I mean, every CCO is slightly different, right, in terms of how they operate. But generally, if there is a problem that is related to their care manager or CCO, we obtain written consent and we say, would you allow us to kind of reach out to your CCO or your care manager and try to figure out what's going on? And then we would, sometimes like the CCOs want us to go through member relations. So I think like some of your counterparts, Craig, and sometimes they're okay with us just reaching out to the care manager directly. I think luckily we haven't had too many calls from people who are receiving care coordination from person-centered services who are unhappy with their care manager. A lot of the times they're experiencing issues that are kind of outside of the care manager's control. They might get a housing subsidy denial and they want, more help with navigating that, or, they might have an issue with a particular service provider or, their residents. So, I mean, as far as I know, we haven't gotten too many calls from your membership, but we're here to serve everybody, and we do our best to try to like investigate and figure out what actually happened and what exactly can we do to help. And part of that, again, is getting permission to loop in, you know, care management, if that's what the person wants.
So, speaking of the calls that you receive, are you beginning to keep data? I know you're very young, organizationally. Are you beginning to keep data on the classifications? Are you keeping classifications of calls that you receive?
Oh yes, that is purely Lynn's job. So I will let Lynn speak on that. But before I say let her talk about that, I will say that we will be releasing a report. I believe like once we've sort of completed a year in operation, we'll be sharing a report publicly. So, you know, stay tuned for that. But Lynn, why don't you tell us about some of the data or information that we're collecting right now?
Okay. Well, does your current deck have a couple of slides that talk about some of the characterization of the calls we've received to date, or is that not for this audience? We capture, is the caller a professional, a self-advocate, or a family member? We capture what the service need they're calling about is. We capture what service we provided. It might be just information, it might be advocacy, it might be help with a complaint or a hearing. So we have an installation of Salesforce that has an enormously complex data architecture, and we're able to generate stratified reports on a ton of things. Those reports are going to be fully de-identified, right? They're not going to have any one individual's protected health information on them. So, but we are hopeful, we should be able, for example, to produce a report that shows you as a care coordination what to date your callers have called us about compared to other organizations. Or I don't think that that's in our present report because that's not been, we actually don't have enough to be able to be making comparisons that would be meaningful.
Yeah,
Sure.
so I think we're
collecting
we're collecting the identity. Of course, like we're not sharing anybody's name or personal information, but we're trying to figure out, okay, where are people calling us from? Are they in Western New York or New York City? And what kinds of issues are they experiencing? Are they having issues getting eligible for services, or are they already enrolled with OPWDD and are having trouble accessing services? Like I said, self-direction is a big one. People who they've enrolled in OPWDD, they've been approved for self-direction, they have, they've started the budget process, but the budget is kind of stuck. It's either stuck at the regional office, or, there was an issue with, the fiscal intermediary not completing the budget correctly, or, there might be calls about, lack of staff. Like ComHab staff is like a huge issue that I feel like comes up a lot, and sometimes like there are issues that, we can't necessarily resolve. Like we can't make ComHab staff appear when there are none, but we can say to OPWDD, like, hey, there's a real lack of ComHab staff. Why is this happening? Do we, like, what are things that, the agency can do to, get more staff to address some of the like gaps that people are experiencing?
Yeah, so that's actually a really great example because I think we see that as a care coordination organization. Our members certainly feel that. But I think the data in general can be very valuable to inform the greater service system, but also reinforce some of the things that we're seeing, because you are independent, right? So I think that gives that data perhaps even more weight. If we are, as CCOs, are getting together and saying, hey, we're feeling this, it could seem like a little bit of, perhaps a conflict. I know we don't approach it like that. But I think that data is really valuable for that reason. Let me see. So what would you say? I'm sorry, you saw a message in there. Miss Brown, your mic is not on. So just so you know. What would you say are probably the most common misconceptions from people that are calling you?
Ooh, that's a good question. Misconceptions about our program, or like misconceptions
About the program, yeah, about what you can do, what you do and do not do. What are the most
Yeah.
common things that you get?
I mean, I think one thing that we have to balance is I think people expect to call us and immediately, like, I don't know, have their issue, like their problem completely solved right away, or that we can kind of, you know, that we're sort of the enforcer for OPWDD. I don't know if I would describe us as an enforcer role. I think we do advocate, and we have been able to get people's issues resolved, but I think sometimes there's this expectation that we can kind of like fix some of these systemic problems kind of in one fell swoop. And the unfortunate truth is that even though we would like to kind of wave a wand and fix some of these things, that they take time, or there might be aspects of the issue that are out of our control. Um, but for the most part, I think like a lot of the times, if there's like, bureaucracy delays, for example, like something has just been sitting at, an office and hasn't been responded to, and, we can usually reach out and get a response pretty quickly. So I think we've been successful in that regard. And I think people have said to us that they feel like they have, more information and are better educated and can, feel more equipped to advocate for themselves, which is, I think the ultimate goal. But I think that the misconception is like people thinking maybe we have more abilities to, or more power to tackle systemic problems than we actually do. But we're certainly doing our part, but we're just one program taking it step by step.
I wonder if you could talk briefly, if it's even possible, about like a collaboration that you've had with a care coordination organization to resolve an issue, obviously in general terms.
Yeah, no, for sure. We've definitely had a few cases. I know from like my experience, because I do some casework myself. I've worked with care managers at CCOs to help with things like the certified residential opportunities process. So, we had someone who was denied that the certified residential opportunities, and the care manager, I think, had tried to do everything correctly and submit all the paperwork, but there was additional information that the office wanted, and so we were able to work together to get the additional documentation over to the regional office for this person. So things like that, or sometimes like the I know we've had a few like environmental and vehicle modification cases where the care manager, again, they sort of had all their ducks in a row. They helped the person, complete all the necessary paperwork and process, but were just really hitting a wall when it came to the bureaucracy. And we were able to kind of reach out to, either through the advocacy office or to the regional office and say, hey, like, what's happening with this? This person has been waiting, an unreasonable amount of time. Like, what's going on? What's the status? So I feel like those are cases where we've been able to help. We've also just like helped people understand like what is the role of your care manager? Like, what is your care manager supposed to be doing? What does it say in the policy? Like, this is what a care manager does. Because I think there's also, an misunderstanding about what does a care manager actually do? What is their scope of responsibilities? And sometimes it could mean like that, their right to change their care manager, reaching out to the CCO and saying, hey, this person is really unhappy with the care manager. They, are otherwise happy with the CCO. They'd like to change. So advising them that they have the right to do that. But I think we try to approach CCOs and everybody that we work with you know, we kind of assume the best until until otherwise proven. So, you know, we try to, you know, go into these situations with open minds and try to figure out what's going on. And then if we really see something that is egregious or, you know, they're not sort of it's in line with the policy, then we, you know, then we advocate.
Well, great. Thank you. There's no more questions in the chat. I'd ask attendees just to stay on for one more moment, but I'm going to give Rachel and Lynn another chance to share final thoughts if you'd like.
Well, for most of the CCOs, we would like to have for our case handlers a designated person that we're going to send. We did have a conversation with your team, and kind of, and we don't seem to have come out of that with a specific contact.
I could certainly look into that for you.
We did talk with you enough that we have a copy of your a consent form that you would like us to use when we're asking you for records, but we do not have a specific person that we're supposed to transmit that to. Actually, it might be on the spreadsheet, but not in Salesforce.
Oh, I do see a question in the chat. Kristen, I think, says, can anybody from any agency utilize your services? So, you know, we're mainly here to assist individuals who are, you know, OPWDD recipients and their representatives and families. That being said, we do get calls and questions from professionals. So I don't know if that was what Kristen was referring to. You can certainly contact us. You know, we can provide information or suggestions, but in terms of actually, you know, actively working with people, we really want to focus on the you know, OPWDD recipients or PCS members and their families.
So a care manager would be probably prefer to have that first contact happen with a three-way call or with a completion of our online form, so that we reach out to the member or their designated representative. What we really don't do is workforce issues for people who are employed in this sector, right? This is for service recipients, not. I did have someone recently who was a family care provider reach out to me. Well, they're in the provider silo, not in the recipient of services silo. So that's a.
Yeah, no matter what your, if you or someone that you know is getting OPWDD services and they're in New York State, of course, and you know, they have a question or an issue, they can contact us. That's kind of the standard. So you don't have to be a member of person-centered services. You can be in any CCO. You can even be someone who, again, it isn't eligible yet, but has questions. So yeah, it sounds like that may have answered Kristen's question. So very good.
All right. Well, we really appreciate both of you being here today. It was a great presentation. I know I certainly learned a lot. If people here could please scan this and share your feedback on the presentation, we sure appreciate it. We will, like I said, this is recorded. We'll be on our website in the next couple of weeks. I just want to thank Rachel and Lynn one more time for coming today and presenting on this important program. So thank you so much.
Thank you for having us, and look forward to hearing the feedback.
All right. Thanks, everyone.